Thank you. Greetings, everyone. Good morning, good afternoon, good evening, ladies and gentlemen around the world. It's so wonderful to see this video, as well as a long list of partners from across the world who registered to attend today. Thank you all for joining us today. This is a time for shared responsibility. Our planet is interconnected than ever before. There is a critical need for working in integrated and synergistic ways. Far too long, our solutions have been fragmented. We talk about One Health, but in action we remain siloed across economic blocks, disciplines, administrative sectors, geographic regions, and more. You know it better than I can say it here. We need to stop treating the planet in a series of unrelated parts rather than one living and breathing system. Our health and well-being is inextricably linked to each other, one and shared. The disparity between global north and global south remains very wide, as many of you agree with me, I'm sure. With the current global dynamics and trajectory of the socio-economic, political, climatic factors, the rift appears to widen more than ever before. Therefore, I hope you all agree with me that there is an urgent and critical need to find innovative and lasting solutions. Some of the key challenges and solutions are outlined in this slide. A critical part of achieving the goals is building a strong, sustainable bridge connecting the global divide, north to south, as well as south to south. The bridge must be scaffolded by consistent and resilient partnership that allows equitable engagement of global professionals so that knowledge as well as resources flow in more efficient, effective, and agile ways. We can collectively change the architecture of global health, public health, animal health, plant health, and environmental health using the One Health dimension, implementing it in a correct way. We, the founding leadership, and many of our long-standing partners, many of whom are on today's call, are committed to mobilize diverse stakeholders to address critical issues in more efficient ways than what we did in the past. That's why we are here today. It's time for shared responsibility. There is no time to wait and there is no time to waste. Today, I'm proud to officially announce the launch of One Health Global Alliance, in short, OHGA. OHGA is a transformative step from our long-standing partnership with a mission of equipping the next generation of professionals and institutional systems to tackle global health challenges. OHGA, with its on-demand global catalyst, brings you all, the global community, an advanced mechanism for synergistic and sustainable ways to make impact, a lasting impact. The strategic domains are complementary and inclusive that facilitate efficient and sustainable implementation. If you start from the right side, building capacity from the outset of ICOFA and many of the consortium we built together with you all, our global network, it has been a laser focused on building capacity and strengthening systems, using knowledge sharing platforms to fill gaps in priority areas. If you look at in the middle, co-creation implementation, our global catalyst mobilizes experts and partner organizations that will bring advanced technology products to collaborate, co-create solutions to tackle complex challenges such as antimicrobial resistance, emerging infectious diseases, and so many of them that you will hear today and you've been hearing for a long time. Consulting. We bring experts where expertise is needed. This is not a traditional consulting, rather a powerful engagement that creates the spark for long-term partnership, implementation, co-creation, and capacity building among the individuals as well as organizations. So these are the key strategic areas. OHGA will engage partners in academia, industry, government, NGO, and beyond, using our overarching on-demand global catalyst. My colleague, Dr. Taqwam, will show you a preview a bit later. This on-demand global catalyst system is an online collaborative space for individuals and organizations. When fully implemented, it will serve our global community, partners, all of you, with the necessary tools to connect and collaborate in much more efficient ways than we used to do. So OHGA, through its regional presence in the US, Africa, Asia, and Latin America, the regional offices and headquarters indicated here, in partnership with its charitable initiatives such as Ohio State Global One Health LLC in Ethiopia, as well as regional bodies across the world, will serve the global community in addressing the planet's complex, wicked problems, such as foodborne, waterborne, zoonotic, vector-borne, emerging infectious diseases, as well as non-communicable diseases. We remain grateful really to so many organizations. Personally, I remain so grateful to all of you. Organizations, individual partners have been working with you the last 16, perhaps more years, who paved the way to reach this milestone today, starting with my home institute, The Ohio State University, and many of the historic funding sponsors that you list on this slide for ICOFA Congress. I would like to call out a few. I am sure I will miss many, and apologies in advance. We don't have enough time to reach to the 324 plus organizations that we've been partnering with, 1,200 strong members of ICOFA network. 2011, inaugural ICOFA. It was back in Ethiopia, my home, where my birthplace is. The Office of Ethiopian President, His Excellency Girma Wolde Giorgis at the time, and others such as the University of Gondar, the International Livestock Research Institute, many came to this inaugural ICOFA to organize it and hosting it for participants from 55 countries. 2013, Federal University of Paraíba, Brazil, and the Sao Paulo Foundation, Brazilian Science and Technology Commission, Higher Education Council, many of them hosted many of you in the room from across the world to really make One Health an emphasis. 2015 in Chiang Mai, Thailand, again, another wonderful global ICOFA Congress that you all hosted. Thank you, Chiang Mai colleagues, including the Vice President Pongra and many of their leadership at the time. 2017, distinguished colleagues from Qatar University and hosting in the Middle East, Hamad Hospital, and many partners, while Colonel, the Supreme Council of Health, many came again hosting the global community to address knowledge sharing in One Health. 2019, University of Montreal, Canada, and a number of organizing partners, many of whom are in the room today. Sylvain Casey, Hadi Yassin, and many partners. Many of our countries and institutions, I cannot finish listing, but like Kenya Medical Research Institute, Sokoine University, many others have been really a critical part of our journey in the past 16 years. As the globalist financing dynamics recently shifted, as you all know, OHGA must utilize innovative financing system going beyond traditional ways. OHGA will be applying social entrepreneurship, mobilizing resources from diverse sources, while remaining to be beholden to you, the global community stakeholders. OHGA and the bridge it envisages to build across the divide will be as strong as its membership base. Therefore, I call upon you, your active participation will be catalytic for our collective success. The founding leadership team, you see on this slide, and many of whom on this panel on the Zoom today, bring to you incredible worlds of expertise and experience, including several members who are current and past director generals at national, international organizations, vice presidents, deans, and several members of us are the National Academies members, as you will hear from at least 2 of the speakers, and at least 4 of our leadership members are within the National Academy of Sciences and National Academy of Medicine. Most importantly, the collective common interest amongst all of us, I can tell you, is the deep conviction to make a very positive and lasting legacy to current and future generations, helping make the planet healthier. Nothing more, nothing less. Thank you all the OHGA founding leadership team, my co-founder and Chief Operating Officer, Dr. Tekwa Morko, and founders of OHGA's predecessor, ICOFA. You have always been so committed, which I remain personally so grateful. To everyone on this call and watching this video recording, this is an alliance. It's not a closed circuit of selected individuals, clubs, or partners. Your partnership, participation, and support are investments to equitable and bright future for everyone. Once again, as a reminder to all of us, let's do our best to stop reacting to the next crisis. Let's build forward-looking, strong partnership bridge. Build the global capacity. Let's keep strengthening systems that are resilient to prevent the next crisis, not react to it, to ensure future generations can live as good or healthier than we leave this planet to them. Together with the founding leadership, I invite you all to join the One Health Global Alliance. Let's bridge the global divide by engaging in consultations that transcend the silos I mentioned earlier, co-creating and collaborating to find solutions, extending sustainable knowledge sharing to build capacity. Let's make this world a better place for everyone. Thank you.